The miracle of birth is amazing, humbling, and wonderful to behold. However, globally over 500,000 women die every year during the process, and for every woman who dies, many others are left with negative physical, psychological, and social effects.
They told me to come here. When I came here, they told me that the pregnancy was supposed to be terminated, so that they can treat the pressure. Because they told me I could not stay without pressure and the pregnancy.
A total of 99% of all maternal deaths occur in developing countries, with more than half of them occurring in sub-Saharan Africa, and this is a real African problem. It is the continued existence of such problems, which are worsened by high rates of poverty, multiple conflicts, and poor governance, that prompted a group of women in the diaspora to form an organization in 1991, which they named ABANTU for development.
Some of them had gone there as students, others were refugees, political, economic, and otherwise. And they felt that they were exposed to various resources that they found out would be useful to impact on the development issues in Africa. So they came together and they felt for them to impact on development, they needed a vehicle, which they named ABANTU for development. ABANTU is an African word found in various African languages that means people, and it depicts ABANTU's people-centered philosophy to development.
Throughout the 15 years we have been in operation, we have been focused to creating a world in which women and men are equal partners at all levels of decision-making and in creating sustainable development. In order to achieve this effectively, we have evolved over time to focus on these 4 areas: gender and wealth creation, gender and good governance, gender and health, gender and sustainable peace.
When our founders conceptualized ABANTU, they felt that they wanted to impact development from a gender perspective. So they felt that out of the various genders that we have in the continent, men and women, the women to a certain extent are compromised and their capacity to access development is thus impacted on. So all our program areas have gender as an entry point.
Through innovation, ABANTU for Development has been able to effectively serve the society over the many years of existence. The latest of such innovations was the East African Caravan, which was birthed as a result of consultation between the United Millennium Campaign, UNMC, and ABANTU for Development. This initiative was to help emphasize the message of maternal health in line with the African Union July 2010 Kampala Summit theme.
Our desire was to actually build momentum towards this African Union Summit so that the issue of maternal health can really be given a high profile. And when we think of the word momentum, immediately what comes into mind is the idea of a train that starts slowly. And that was the idea that we had in mind when we conceptualized the East African Caravan. We would have loved to use a train, but because of the challenges of the railway network, we opted to use the road network. And we identified a caravan, which is a vehicle that could use the roads, but could also give us an opportunity to decorate it as we wanted. Because as I said, we definitely wanted to make an impact.
In collaboration with the African Women's Development and Communication Network, FEMNET, the Gender is My Agenda Campaign Network, GMAC, the White Ribbon Alliance, WRA, the Solidarity for Women's Rights Awareness, SOA, and many other partners, the Caravan set out to meet her objectives, which included holistic interaction with the East African citizens on the No Woman Should Die While Giving Life message, offering some basic health services like blood boosters and dewormers, and offering East African citizens an opportunity to participate in the African Union deliberations by signing a petition encouraging our leaders to also act.
In the organization of the East African Caravan, we wanted to capture the main objectives of the caravan.
The planning process was over and the caravan was ready to roll. What a better place to begin than Kibera in Kenya?
We wanted to have a symbolic flag off of the caravan so that the participants of this East African caravan can have the permission to move on from Kenya to Arusha, Tanzania, Mwanza, Kigali, Rwanda, and then culminate in Kampala, Uganda.
Let us now share some of the experiences we went through as we conducted the caravan throughout the East African countries. In Arusha and Mwanza in Tanzania, the White Ribbon Alliance had earlier done much work on awareness creation in regards to the whole caravan, and on this very cold morning in Mwanza, the reception was overwhelming. The nurses and midwives, accompanied by a marching band, hit the road carrying placards with the very message on maternal health campaign. The caravan marched across Arusha Central Business District from Mount Meru Hospital to Karen Maternity Ward, about 2.5 kilometers from the referral hospital. The experiences varied from challenges faced by healthcare workers and those of mothers with various complications to that of men widowed through maternal mortality. The story in Rwanda was positive and markedly different from that of her neighbors. The East African caravan camped at Muhima Government Hospital, and we could not help noting the high standard of hygiene and the sterile environment at the facility. Rwanda has a very high rate of antenatal attendance, and this is the healthcare workers' attribute to the introduction of a door-to-door maternal health education by community health workers who also offer antenatal and postnatal services. Our entry to Uganda through Katuna border was indeed the climax. Akina Mama wa Africa, our partner in Uganda, together with others implemented a series of events that led to high impact that the caravan experienced in Uganda.
From our part as Akina Mama Africa, we joined the caravan because we are members of SOAR, which is Solidarity for African Women's Rights. It's a coalition, a Pan-African coalition that has over 30 organizations across Africa. And SOAR, the aim of SOAR is to work towards the universal ratification and implementation of the African Women's Rights Protocol.
The caravan was received by dignitaries and a host of partner organizations with pomp and jubilation. But that was just as far as we could go with our celebrations.
Very big number deliver at home, and this is a very big challenge to the district. Worse still, these mothers may deliver even alone in their homes.
The reality on the ground is grim. People experience a lot of problems, especially high rates of maternal mortality due to preventable pregnancy-related conditions and infections, age factor either too old or too young, infrastructural causes, and negative cultural practices.
These were very well demonstrated by the experience that we had in Barara Hospital, where, while actually helping the healthcare providers to give service, we were called upon to help a woman who had just walked in, who had just been wheeled in, having been in labor for 2 days prior to this, while her mother-in-law was actually delivering herbal concoction, expecting that since the woman had delivered 6 other children before, this 7th one will also be delivered okay. Once they realized that there was a problem, they actually decided to come to the hospital, but it took them another full day from where they were to the hospital. And when they got there, between the gate and by the time the woman was actually seeing the doctor, it was 2 hours. But this time, quite a lot had happened. One of the complications of maternal health had occurred in that this woman had ruptured her uterus. The baby could not have been saved, but the woman was there in front of the doctor with a pulse, and it would have been possible to save her, to go into theater and to remove the dead baby and to stop the bleeding. Unfortunately, I'm sorry to say, because of other delays in the health facility, by the time the woman was being wheeled into theatre, which took quite a while to prepare, the woman had lost her life.
The experience with this patient graphically demonstrates the 3 delays that causes women to succumb to the immediate cause of death caused by delays. These delays are the delay in decision making, the delay in reaching the health facilities, and the delay in accessing quality health care once in hospital. So far, our journey has taken us 13 days full of activity. The caravan has managed to cover 9,457 kilometers around the East African countries, during which we dewormed over 20,000 children, distributed over 20,000 blood boosters to expectant women, and distributed over 7,200 packets of sanitary pads to girls.
We have traveled from Kenya through Tanzania, Rwanda, and then through a number of towns in Uganda, promoting awareness on the issue of maternal health and child health, and also seeking people's views on what can be done to improve the status of maternal health in our countries.
Armed with these experiences on maternal mortality, the East African Caravan arrived at the African Union Summit with the message enshrined in a petition signed by over 50,000 people. Act now. No woman should die while giving life. The multiple media briefings, the passionate presentations, and the intensive lobbying during the African Union meeting had a positive outcome, which is a recommitment of the Abuja 15% budgetary allocation to healthcare, as well as specific attention to maternal and child health issues. Since the caravan in July, we have seen several other activities on maternal healthcare, and these include the Wild March of Women marching from Freedom Corner to Parliament Building on 19th August 2010 to reinforce demands on the ratification of the Maputo Plan of Action and the campaign for the accelerated reduction for maternal mortality in Africa, KARMA, at KICC on 9th November 2010. Let individuals, groups, and governments recommit themselves to the message.
No woman should die while giving life.
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 No woman should die when giving life.